Thank you all for joining. I wanted to let everyone know that we are now recording this presentation, and I'd like to introduce myself. My name is Erica Scouten, and I'm the Senior Director for Neurosciences and Spine. And I'm thrilled to be able to introduce our accomplished neurosurgeon, Dr. Ahmed Raslan. He holds the title of Vice Chair for Clinical Affairs for Neurological Surgery, the Director of Epilepsy, as well as Brain Mapping and our new HIFU program. He is also the Director of Clinical Operations, as well as the Medical Director for Quality here at OHSU. And with that, I am thrilled to be able to hand it over to Dr. Raslan to give his presentation.
Thank you, Erica. Thank you, everyone, for made this presentation. We are going to try to make this, friendly. And if you have questions, please put them in the chat box. We'll go over them. I will dedicate half the time to giving the presentation, and the other half is to respond to questions. The purpose of this presentation is to make our beloved patients and public and neighbors aware that OHSU has acquired this technology, and we are about to start treating patients. I think our first patients are lined up on the end of this month. This is an exciting technology called Focused Ultrasound, and we'll talk about why that treatment is good. And the title of this talk is Focused Ultrasound for Treatment of Essential Tremor. And we're going to focus on essential tremor. There's also another condition that is very, very similar to essential tremor that this treatment could benefit as well as just Parkinsonian tremor. Patients with Parkinson disease who complained primarily with tremors are also could consider themselves the same as essential tremor. So if you are on the call and you have Parkinsonian tremor, everything is in this talk applies to you as well. All right, so let's get started here. That's me. Okay, I think that's unimportant. Overview. So we're going to talk about some facts for essential tremors and why that disease is a disease that we would like to treat sometime. What are the treatment options? What is focused ultrasound? And how does focused ultrasound work? What happens on the treatment day if you pass through all the necessary evaluation and indication for focused ultrasound? What happens on treatment day? Who is a candidate for focused ultrasound and what to expect? Patient results and 3-year clinical results, insurance coverage, and questions and answers. Okay. I want you to meet one of our patients. This is courtesy of Incytec, the manufacturer of the company, of the technology. Please listen to Mitch.
I've always had essential tremors since I was a child. In a work setting, I need to write, I need to be able to sign contracts, I check into hotels, and the shakes hurt. I mean, it makes it very difficult for me to get through those parts of life.
I think a lot of you could identify or relate to Mitch here. I treat lots of patients with essential tremor, and they tell me that essential tremor goes into 3 phases, and that's the patient's word. This is not science or doctor's word. This is the patient's word. They tell me that it goes in the phase of inconvenience. Becomes just starts with being something inconvenient. It's just inconvenient to have tremors, but aside from that, life is the same. And this is usually the stage when they take medications. And then goes into the next level, which it becomes a little bit of an embarrassment. People don't want to, be out in a restaurant and then trying to have soup, and they see everybody looks at them and see that they're spilling or can't have a drink. And then it gets in the latest phase to, functional disability. I can't write, I can't do the things I do. I like to paint and I can't paint. I like to, use a power tool or a drill or shoot guns or whatever you want to do, and you cannot do it. So these are the stages, and they're all important, and we treat patients who have all these different problems. So essential tremors fact, this is also referred as familiar idiopathic or benign tremor. Essential tremor means that there's no known cause or medical condition. That's why it's called essential. And in up to 50% of cases, it's hereditary, which means, they have a father, a mother, somebody in the family who has the same condition. It can progress to the point that daily activities are difficult and may require assistance. And that's what I talked about, the progression from being an inconvenience to an embarrassment to being a dysfunctional or disability, if you will. So what are the treatment options? Do we have treatment options? Can we cure essential tremors? I would say that essential tremors are one of those diseases that we really can't cure, but we can treat, and we can treat effectively sometime, and in a way that impacts the patients and impacts their families and impacts how they enjoy life. So medications, beta blockers, a drug called Propanol, or the commercial name is called Inderal, anti-seizure medications such as Primidone, and anti-anxiety medications. They can and do work initially. Over time, they don't work as much, and over time, the amount of reduction of the severity of the tremors becomes insufficient, meaning, when your tremors were little, the medications were very impactful, but when the tremors are becoming severe and frequent, then the medications effect, even though it reduces them, the remaining amount of tremors or the duration of tremors is still disabling. We do have surgical intervention, and this is a list here called deep brain stimulation, focused ultrasound, RF thalamotomy, stereotactic radiosurgery. But you can think of the treatments for tremors, it goes into two groups. One group is, implant wires and change the brain by sending electrical signal. This treatment is good, and it changes the brain, but requires an intervention. I would call, moderate to major intervention. And also you need to have, frequent programming, but it can treat the tremors on both sides, and it's also reversible, meaning you could turn the device off. Or you could deliver a standardized lesion to the part of the brain that's dysfunctional, and you could do this using multiple methods. RF thalamotomy is using a probe that penetrates the brain, so there's a risk of that. Radiosurgery uses radiation, and there's some radiation side effects as well as, and also doesn't work right away, so you don't have a confirmation that it's the right amount. This is where focused ultrasound shines, because as a method for delivery of intentional ablation to a part of the brain, it provides an immediate effect, but while also at the same time non-incisional, meaning no incision and no surgery, non-interventional, non-invasive. And also you can have a feedback, so you can confirm that you not only not targeting the correct spot, you are also avoiding everything that you should avoid. Other supplemental wearables for temporary effect that you don't have the same magnitude, something called Calia, and there's a whole bunch of those. They do peripheral nerve stimulation to try to help with tremors, but their magnitude of effect is good, but not as good as the definitive surgical treatment. So these are the treatment options we have. Focused ultrasound is actually kind of old, meaning started in the 50s, and this is in 1953, I believe. This is a magazine called Science and Mechanics, and then this is the wonderful machine that stops Parkinson disease using, focused ultrasound. You see here, there's like these four things at the top. These are called transducers. And at that time, the machine had four transducers, or four elements of sound emission, or four sound emitters, because focused ultrasound is basically sound energy. Just to give you, a comparison, our current machine uses 1,024. So we started by 4, now we have 1,024. What is focused ultrasound? It's an incisionless brain surgery performed in the MRI machine. That's very important because the MRI machine
I want to mute you.
provides feedback. It's an outpatient procedure, 2 to 3 hours with no cutting. Treats the tremor on one side of the body, usually the dominant side of the body. That is not a must. We sometimes treat the non-dominant side of the body if it's the side that the patient wishes to treat, or the side that has a significantly worse tremors compared to the other side. We treat the dominant side of the body if patients have two sides of tremors are equal, or if the dominant side is the side with more tremors, which is the most common case here. This is an example. This is called growing a spiral. Those of you who have known And neurologists that have done this before, they understand that drawing the spiral, and that's what it looks like before. That's what it looks like after. How does focused ultrasound work? Sound waves are directed from a helmet-shaped device with no incisions, and this helmet shape has 1,024 elements that they focus and converge in one point. Each one of those wave or beams, if you will, is completely harmless to the brain. Only when they converge, and only in a zone of about 2 millimeters, that these converging sound beams could give energy that's high enough to raise the brain temperature, but that's only in a zone of about 2 millimeters. In that area, the damage occurs. Outside of that, there's absolutely no damage. Where the sound wave meets a lesion about the size of a pea is made to disrupt the abnormal circuit. And the target is a nucleus, portion of the brain called the thalamus, a sub-portion of that called the VIM. It's the same area where we use deep brain stimulation and surgical thalamotomy. So it's the same part. So we know that's the pathologic part, and we change it using different methods. Many patients, I would say the vast majority of patients, will experience immediate tremor improvement with minimal complications, if any. That's what it looks like. That's the helmet, and it's attached to the MRI. And this thing on the background is the MRI machine. This is just the artistic rendition of the sound beams coming out on the MRI machine. And that's me or the physician or the radiologist, and the MRI tech will sit in the room where we can see the patient, and this is the planning software that allow us to tell the focused ultrasound where to deliver that sonic destruction. What happens on the day of the procedure? So in the pre-op, if you arrive in the morning of the procedure, the patient is shaved. You have to shave it just like me, completely shaved, and because so nothing blocks the ultrasound waves. After numbing medicine is applied, a frame is secured to the head to prevent it from moving during treatment. And that's very important because you don't want the brain to move while a sonic ultrasound or sonic beam is delivered. Then we do the planning, which is very similar to planning that was done when you do deep brain stimulation. During the treatment, the patient is awake and lies on the MRI table, which moves in and out of the MRI scanner. MRI images are taken to plan the treatment specifically tailored to that patient. This type of surgery is a revolutionary surgery, belongs to the newer and ever increasingly brands of surgery that is the surgeon role is entirely cognitive. In other words, me as a surgeon will not perform a surgical cut on the patient, on you. Rather, I will use technology to deliver an energy that is completely invisible, and it does not cause any incision to the body and then causes change inside your body. The cognitive part is choosing where to deliver that injury, if you will, and also be responsible for all the steps that secures the safety. This is a cognitive surgery, and it's hard. And the good news is for a surgeon like myself, we got this technology here, but the planning and the cognitive part is exactly what I do when I treat patients with Parkinson's disease or essential tremors for deep brain stimulation. It's the same exact cognitive concept, except I add to that opening the head and putting the wire, and what I do it with something called laser ablation. So if you are a surgeon that does these procedures, you are already trained and have the knowledge enough to perform this procedure. That doesn't mean that we don't obtain additional treatment. I did obtain additional training for this, and I had to travel to sites where they perform the procedure to be able to kind of learn from the real life experience that they gathered after they started doing this procedure. We do light dose of ultrasound waves are applied. So this is to kind of do a test, are applied to pinpoint the area of the brain causing the tremor. Throughout the procedure, the patient is monitored for tremor improvement. So whenever we keep checking and checking and checking, and then the provider makes we could change the ultrasound to make sure we hit the right spot every time. And then once we verified that we are hitting the correct spot, this is the sweet spot that we want to hit, and then we get high energy ultrasound waves are applied to create a small ablation or lesion and provide improvement of hand tremor, sometimes also leg tremor. So who is a candidate for focused ultrasound? Who would this be good for? You have to have a confirmed diagnosis of medication refractory essential tremor or tremor predominant Parkinson disease. That's what I did talk about at the beginning. You have to be 22 years or older for essential tremor and 30 years or older for tremor predominant Parkinson disease. I would contend that 99.99% of patients will meet that metric. You have to be able to tolerate the procedure with or without some form of sedation. I would say mostly without any form of sedation. And the reason for that is that sedation will reduce the tremor. And we use the tremor to kind of find out whether we're hitting the right spot. So ability to kind of get a feedback on the extent of tremor is critical here. We have to be able to communicate sensations and feelings during the procedure and can fit in the MRI scanner and can activate the stop sonication button, which is a safety button we give to the patients to stop the process if they feel anything that they don't like. Is focused ultrasound right for you? This treatment works best for patients who have tremor symptoms that are worse or advancing faster on one side or the other, or they take blood thinners or have other conditions that makes other options such as deep brain stimulation dangerous. You and your doctor will decide if you should stop blood thinners before focused ultrasound. Usually we do for a very short period of time. Or do not want to have invasive brain surgery or commit to the ongoing adjustment that the brain stimulation require or changing the battery. I would say also that you could have tremor on both sides, but if you wish to treat only one side, you are also a good patient. Okay? So if the impact of both if you want to impact treatment on one side and you have equal tremors, but one side is impacting you more, it's perfectly fine to have treatment for that one side. Who is not a candidate for focused ultrasound? If they cannot have an MRI due to implanted metallic device like a pacemaker. So having a pacemaker, if the pacemaker is approved for the type of MRI that we use at OHSU, which is, Siemens 3 Tesla MRI, this might be a possibility. But having a pacemaker becomes an issue here because not because you can't get the focused ultrasound, is because you can't get the MRI. But I would advise to kind of actually check what a brand pacemaker you have and check with the manufacturer on whether or not that's MRI approved. If they have a body weight greater than 300 pounds because they wouldn't fit on the MRI table machine, have allergy to MRI contrast agent, which is gadolinium, have a high skull density ratio, have a history of abnormal bleeding or severe conditions such as advanced kidney disease, unstable cardiac disease, severe blood pressure, or certain brain problems, yes. So if you are really, really sick that you can't lie flat on the MRI table, then we couldn't do that. Some kidney disease makes it impossible to give an MRI contrast, and some high blood pressure make it very risky to cause the ablation. The skull density ratio, we check for everyone by getting a CT scan, and I would say 9 out of 10 patients will find themselves compatible with the treatment. If you're unable to tolerate being still for 3 hours treatment, or if you are pregnant. So as you see, most of the contraindication has to do with the ability to get an MRI and lie flat. What are the benefits for patients? It's an immediate and lasting tremor improvement. Well, what if tremors start coming back? Is it lasting for everyone? It's lasting for the majority. You could reapply the treatment. It causes significant improvement in quality of life, as we talked about, when tremors is no longer just an inconvenience, it's more of an embarrassment or a dysfunction or disability. It's an outpatient, have the same day treatment, little to no risk of infection, no implants, probes, or radiation, which also means little or no risk of bleeding, no anesthesia, minimal risk of side effect or complications, due to insertion of device. But it's important to understand few things. Focused ultrasound can only be performed to treat tremor on one side of the patient body. That is the current labeling, only one side. It can improve tremor, but may not stop it completely, but it will improve it enough that you will feel a difference in your life. It's not a cure for essential tremor. It will not stop the progression. We talked about this because this is that condition cannot be cured, but can be treated effectively. This is the 3-year clinical results. 76.5% of patients had tremor improvement at 3 years follow-up. That's a meaningful, impactful improvement. But the most common adverse event immediately were balance and gait disturbance, numbness or tingling, and headache or head pain. But of all the adverse events, 50% resolved within 30 days. There are some other things such as dizziness and taste and slurred speech and vomiting. But at 3 years, the persistent adverse events are 4% imbalance, 4% unsteadiness, 2% gait disturbance, 2% musculoskeletal weakness, 9% numbness and tingling. And by the way, these adverse events are very similar to surgical thalamidotomy or less, and also compatible with some of the side effects of deep brain stimulation. This is what you kind of expect from we'll see a short video on the difference between before and after for patients who undergone the therapy. Those particular patients had tremors on the right hand. I will play that again. So it's the only machine in Oregon. And OHSU is the only hospital in Oregon performing focused ultrasound for the brain. And for insurance coverage, Medicare covers it in all 50 states. Aetna is approved national coverage. Blue Shield Blue Cross approves it in 39 plans. Cost of cash paying patient is set by the medical center. And you need to contact your health plan member service department by calling the phone number listed on the back of your insurance ID card. Ask if MRI guided focused ultrasound for treating tremors, CPT code 0398T. Again, CPT 0398T is a covered benefit for outpatient based on your health plan. But generally, it is covered for Medicare. This is an email that's called focusedultrasound@ohsu.edu, and that's the phone number that you can call when you have questions, and you could send your questions to that email number, or self-refer yourself. And time now for questions and answers.
Dr. Raslan, I have a list of questions here I can help you go through, and thanks for those of you who have put your questions in the chat. Please continue to put any additional ones in and we will make sure to get to those. The first question is treatment appropriate for benign head/vocal tremor?
Unfortunately, no. Any tremor in the middle of the body, such as the head or the trunk, is considered bilateral tremors. So the impact of focused ultrasound by treating one side only on what's considered bilateral tremor will be less. This is a condition that will require deep brain stimulation if it's severe enough.
Wonderful, thank you. The next question is, does this require that the entire head be shaved?
Yes, it does require that the entire head will be shaved, just like me.
Okay. The next question is, are there side effects?
Yes, there are side effects to any treatment, and we went over the side effects, which is the long-term side effects all focus on gait and imbalance, but the vast majority of patients find this well tolerated. The rate was 4 plus 4%, 4 if it's imbalance and 4 gait disturbance, but that's over a long period of time, which means 92% will not have this side effect. But people who develop this side effect are still ambulating, but they may need assistance with a cane or an assistive device.
Wonderful, thank you. Another question is, since caffeine amplifies my tremor, would coffee help pre-surgery?
It's not necessary. We don't have to do this. If if you have coffee and you have more tremors, that's fine. But I don't think it's necessary to have coffee or caffeine prior to the procedure. And we'll go over these things with an actual evaluation. If for example your tremors are sparse, meaning they come and go over infrequent time, but when they come they're severe, we might ask you to do something like this, but the vast majority of patients don't need that.
Okay, thank you. The next question is, can you do this if you have a pacemaker?
Only if your pacemaker allows you to get a 3 Tesla MRI. So that's the minority of pacemakers. So the general sentiment that if you have a pacemaker, you can't get an MRI, and if you can't get an MRI, you can't get focused ultrasound. But I would advise those who have pacemakers to contact their manufacturer and tell them, can I get a 3 Tesla MRI? And if the answer is yes, then we can do it. If the answer is no, that we can't.
Okay. The next question is, can you only have one side treated or only one side at a time?
No, one side in your lifetime for now.
Okay. And it says, is there a chance that the ultrasound could make the tremor worse, if not right away, then later down the road? How often can a person have the ultrasound treatment?
Great question. This has not been observed at all, worsening tremors due to focused ultrasound. It has not been observed. We have observed the recurrence of tremors over time. I don't think there's a limit to the number you can take, but I'm not aware of anybody who had it more than 2 or 3 times.
Okay. And then this next question asks, what is the number of patients who have undergone this procedure?
Worldwide exceeds thousands. So this is because this procedure, Insight Tech Company, is an Israeli company, and the procedure is performed routinely in Europe and in Israel and Australia, and it's been approved in the US for many years now, about 6 years. And prior to that, it was in the research phase, so there are thousands of patients that receive that therapy.
Thank you. The next question is, can a patient who's previously had one epileptic-like seizure have focused ultrasound treatment?
Not for the seizure, but for the essential tremor, yes.
Okay. And then there's a couple questions, I'm going to combine them, where it says, what is the maximum age for this treatment? So what's the oldest age that you treat for?
Okay, so I don't think we have defined a maximum age, but the oldest patient that I'm aware of that received treatment was 99 years old. I just examined a 92 years old patient that we may get it. So it's really not a chronological number rather than a condition. If you are old, but you are able to get an MRI and you're able to tolerate sitting, lying still for 3 hours, and you're cognitively coherent, so we can communicate with you, I don't see a reason why not.
Thank you. And I know you might have touched on this, but does this apply to those who've only have a hand tremors? What about head tremors?
You can have it for hand or leg tremor on the one side of the body. Head tremors are considered bilateral tremors. Any central tremors is considered bilateral tremors and would probably benefit from deep brain stimulation, not focused ultrasound.
Thank you. Another question is, how many patients were in the 3-year study?
This was 56 patients.
Okay. Thank you. And another question is, can the procedure help Lewy body dementia patients who might not have noticeable tremors, but whose mobility is compromised through a loss of motor skills?
No, unfortunately, no. Currently, there is no surgical treatment for Lewy body dementia, but stay tuned. We might have a trial here at OHSU specifically for Lewy body dementia. We will discuss that through another press release when we get secure funding for the study. But yeah, it's a good question.
Thank you. There's lots more questions coming in. The next one is, where's the numbness afterwards usually?
Usually around the face and the hand. So the VIM, the nucleus and the thalamus that is abnormal, is intimately connected to what's called the sensory nucleus of the thalamus. And this group of neurons that we would want to destroy are on the back end of this nucleus. So it's common that people will have this tingling sensation or feeling, what we call, oral numbness around the mouth and in the hand. And in fact, a lot of time when we see this initially, we conclude that we're hitting the right spot. Reality is that it gets better for the vast majority of patients, but for some, it remains.
Okay. This next question, I'm going to try to make sure I pronounce this right, but it says, I've been on alprazolam, I think that's how you say it, for a lot of years now. Thank you for treatment, and it helps, and it also helps for anxiety. Would I need to go off this med?
Well, I think we need to do an evaluation for you to see if you are responding to medical treatment, why do we need that procedure? I think generally speaking, if there is a medication that can help you and you don't have the embarrassment or the dysfunction, then we may not need to do this surgery. We will reserve the surgery if the medication stop working. But I don't want to think of surgery as an alternative to medication. It's rather a treatment when medications stop working.
Right. Another question is, how long does this treatment last, and is jaw tremor treated?
Jaw tremors are considered head tremors, and it's supposed to last forever. I apologize.
Okay. Another question is, you mentioned monitoring tremors during treatment in order to target the treatment. What if the tremors are not constant? In other words, I primarily experience the tremors when writing, drinking, shaving, etc. They are not constant. So
We'll figure out a way to induce the tremor. We'll ask you to write. So when we say during the treatment means we'll give you something to write to see the extent of tremor and then deliver the sonic energy, which usually is delivered in about 10 to 15 seconds. Obtain an MRI scan, which takes another 45 to a minute, 35 seconds to a minute. So ask you to write, induce the tremor, do the test lesion, ask you to write again, and that's how we know it gets better.
thank you. Another question concerning, would the use of diazepam during the process cause problems?
No, sure.
Okay.
But I think if we get to the point that the procedure is indicated, we will go over, what medications to use and what medication not to use. We would not want you to be on diazepam on the day of the procedure.
Thank you. Another question here to confirm, this is the only option after a patient has tried meds. First question, and how debilitating does ET have to be before a patient qualifies for this treatment?
So it's not the only treatment. We went over treatment. There is other surgical options, and there are other non-surgical options, such as the device in your hand. We generally consider tremors to be medically to be disabling when they impede activities of daily living, if they impact your ability to write, to eat, drink, to shave. And if it gets to that, that's a surgical grade tremor. But the treatment options, there are other things. Deep brain stimulation is another great surgical treatment, which is also provided at OHSU. Surgical thalamotomy is by putting a probe. Probe is in the brain is an option, which we also perform, but I don't see the point of inserting a probe in the brain if we can do the same thing without inserting anything in the brain. Gamma knife is an option, but I also don't see the point of using radiation and not have a treatment effect for 2 or 3 months, which you couldn't tell how much treatment is delivered, and you can't undo it at that point when you have a way to do that and get an immediate feedback. So there are other options other than focused ultrasound. In the world of ablation, focused ultrasound is the most superior, safest, and effective option. But there's another option called deep brain stimulation surgically, and there are non-surgical options.
Thank you. Another question here, does focused ultrasound help any symptoms besides tremors?
No.
Okay. Another question in regards to having epilepsy and essential tremor. I have epilepsy and essential tremor. What if you have a vagal nerve stimulator implanted for epilepsy? Does that not make you a candidate?
Good question. So no, you could have it. I have to check. So in order to get a 3 Tesla MRI when you have a vagus nerve stimulator, you will need to have a special head coil that allow us to obtain the MRI, which is manufactured by Siemens company. But is that the same coil we use during focused ultrasound? I will have to get you back on this one.
Okay, great. I will take note of that.
Yeah.
Another question for you is, can you do this if you have a spinal pain controller?
If it's MRI compatible, but a spinal pain controller, you're talking about a spinal cord stimulators. Most spinal cord stimulators are compatible with 1.5 Tesla MRI, not with 3 Tesla MRI. Some of them are, and they will become compatible with 3 Tesla MRI in the future. This is a procedure I perform myself, so I'm aware of that. So, the answer to that question is, let's check with the manufacturer if your MRI, if your device is compatible with a 3 Tesla MRI.
Thank you, Dr. Raslan. I think you have touched on this, but I'll ask it again. How bad does a tremor have to be now? My mother got so much worse as she got older, where she would not be able to hold a cup. I understand this could be a hereditary condition.
Can you say that question again?
It says, how bad does a tremor have to be now? My mother got so much worse as she got older to where she could not hold a cup. And I also understand that this can be a hereditary condition. So essentially, how bad does a tremor have to be?
It has to be impact the activities of daily living, such as eating, drinking, or writing. I just got a page from an emergency because I'm on call. Would it be possible to take 3 minutes to answer this? It's regarding a patient. So
Absolutely.
I will take a little break, okay?
Thank you, Dr. Raslan.
Thank you.
Okay, wonderful. Thank you, Dr. Raslan. And you have lots more questions coming through. So the next question is, I'm not sure if I'm severe enough. I am in your first or second, or if I'm in your first or second stage, should I come in for an evaluation question?
Yes, you should come in for evaluation.
Thank you. Another question is in regards to insurance. So is it covered by insurance, specifically Oregon Health Plan?
Yes, Oregon Health Plan is, to my knowledge, approves it. But also, OHSU holds a special place. We could argue with insurance. We could argue for exemptions for medical necessity. So I wouldn't think of insurance as a barrier to getting this treatment. Just come and get evaluated and let us do the work. We work also as advisors to the Oregon Health Plan, so we could change the policy if this is a set policy, and we've done that before for many patients. We just did this for deep brain stimulation for epilepsy. So don't let insurance be standing in the way. We are your advocate. We will argue with the insurance. We'll ask for an exemption. We'll ask for a policy review. We'll ask for a third-party review. There are things that we can do to get beyond what's apparently not approved benefit.
Wonderful. Another question is, my initial diagnosis was done by Kaiser, but I don't have the records anymore, and I'm not a Kaiser member anymore. So would I need a new diagnosis by a different neurologist?
You don't need a new diagnosis, but you will still need to be evaluated by my neurology team. So that's a great question, by the way. Let me tell you how we generally handle these referrals. We would like to see everyone, but if someone has a current neurologist who is treating them and they already have the diagnosis and the treatment, I don't need to send them to our OHSU neurology group for reevaluation and approval of the candidacy for therapy. But if you haven't seen a neurologist for some time and you don't have a current one, then we would send you to our own neurology group for evaluation, and then you will see me afterwards. Also, if patients have a neurologist, but their diagnosis is questionable, or I have questions regarding, is this truly an essential tremor? Is there something else going on? Then I will get my neurology team involved. This is a long answer to your question. The short answer, come in and we'll ask our neurologist to evaluate you.
Thank you. Is there any chance this procedure can help with restless leg syndrome?
It's not studied for that condition, unfortunately.
Another question, can partial deafness, completely deaf in one ear, be a problem in the MRI or with the procedure?
As long as there is a method of communication, if, for example, if you use a sign language and we get a sign language interpreter, the point of hearing is communication. If we can establish communication in one way or the other, then we can do the procedure.
Okay. And then another question here, do I understand correctly that after treatment to the dominant side, you still can't have the other side treated?
You can't have treated with focused ultrasound. If it becomes a problem, you could do deep brain stimulation.
Okay,
So it's not like you can't have any treatment. You could have other treatments if we need be, but it will not be focused ultrasound unless we make a scientific leap and then that becomes a possibility.
okay. Um, Here's another question. I have had DBS surgery and it is no longer effective. Can I have the ultrasound treatment?
Great question. So the answer is yes, but we would have to examine your deep brain stimulation system to see whether we have to remove it first before we do the therapy, or we do it while the deep brain stimulation is in. The vast majority of patients will require their DBS to be removed, not for anything other than it's not going to be MRI compatible when it's dysfunctional, and certainly may not be MRI compatible with a 3 Tesla MRI. They might become MRI compatible with 1.5 Tesla MRI. So the answer is yes, that's actually one of the indications, but we may have to remove the DBS first.
Okay, thank you, Dr. Raslan. And this is more of a request, but if it would be possible to put the slide back on with the insurance info / who covers that information.
Here you go.
And while you're doing that, there was another question about if we will be emailing out the recording of this presentation to registrants or to people who registered via their email. We need to take that offline, and I do need help from some of our tech support to see best way for that, or if it's going to be posted in a spot. But regardless, we can email the group out.
I think we can do some of things, but I think there's some patients in this slide, so I don't think we can share the presentation as is. Meaning forward a recording or the presentation. We could create a PDF format that doesn't include patients and then share it. Yes, absolutely.
Thank you for putting up the insurance coverage slide, Dr. Raslan. Here is another question. What happens in the brain to cause essential tremor?
It's not known. That's why it's called essential tremors, because the true pathology is not known.
Okay, thank you. And I'm skipping over some of the comment sections, but I'll let people read as far as some of the specifics about contacting your health plan members from one of the participants here. And someone was also asking about if we can share the PDF of the slides. Yes, we can do that. And would be possible for others to download. Someone is asking specifically about how much does the procedure cost without insurance?
I don't know the answer to that, actually. I have to contact OHSU Financial, so I don't know.
Okay, so that can be another question we can follow up with specifically.
Okay.
And I know, thank you, Dr. Raslan, for answering all these questions. There's still a few more here.
Yeah.
Sounds like, did I hear this right? That it is not done for essential tremors of the head. I've had them for over 20 years.
Tremors of the head are considered bilateral. They would better be treated by deep brain stimulation. And yeah, I don't think there's a good chance of focused ultrasound working for those because it's bilateral tremors. Generally speaking, treatment of tremors works best for what we call appendages, limb tremors. Central tremors are harder to treat, and if we want to try that, we have to do deep brain stimulation to treat both sides. And also because it's irreversible therapy, meaning if it doesn't work, we could remove it.
Okay. There's a comment in here about a wonderful presentation, Dr. Raslan, and thank you for making this information available to the public. There's also a question specifically around how to get evaluated for the study. And I know you had put the contact information, Dr. Raslan, maybe if we could go to that slide just so we can make sure that everyone has that number. So if you'd like to get evaluated, please reach out to either this email or this phone number.
Okay, that's
another question. Are essential tremors hereditary? If so, is there anything to prevent or prolong the onset of this condition?
The answer is hereditary in about 50%, not for everyone. So people could develop it without having an ancestor that gives it to them. And no, there's nothing that can be done because the true pathology is not known, and even the genetic inheritance gene is not known. So the hereditary nature is based on observation, not based on genetic isolation of the transferable gene between, the parents and the kids.
Thank you. There's another question specifically about, do we call the 503-494-4314 for any additional information or questions? Yes.
Yes, my assistant name is Nayama, and she would be happy to answer your questions. She's wonderful.
I could not agree more, and that's also where they can call to get appointments for evaluation as well. Another question is, do you know if Kaiser Permanente covers this?
I think Kaiser covers this. I think the way Kaisers work is that you get an evaluation by Kaiser, and Kaiser refers you to this. So yes, I think Kaiser would cover it because it's an approved therapy. It's just that the physicians at Kaiser will need to say, sure, we agree that you need this, and we'll send you to get it done. So it's not a matter of approval, it's a matter of whether your Kaiser physician is on board with this treatment. And I think you should talk to your Kaiser physician regarding that.
Thank you. And Dr. Raslan, there's some nice comments about thank you for taking time to share this information, and that you gave a fantastic presentation. I do want to try to make sure there's a couple more questions to try to get as many as we can before our time is over. Another person asked, did I hear you say it can be beneficial for epilepsy?
The official answer, it's not approved for epilepsy yet, but certain forms of epilepsy may be treated by this technology in the future. So if it becomes beneficial for epilepsy, it will be in the future and for very, very specific narrow indication. So the general answer is no, but I have to know more information to give you a more precise answer.
Okay, thank you. Here's another question. 45 years ago, I showed my doctor Mr. Shaky Hands and said my dad also had worse tremors. I think I'm saying this right. She called it familiar tremors. Could this be essential tremors?
It is. Familiar tremors and essential tremors are the same thing. I think this was one of the very first slides.
Okay.
Familiar tremors and essential tremors are the same thing. They have other names for this tremors, just for everybody. The synonyms for essential tremors: familial tremor is one, idiopathic tremors, also action tremors or intention tremors. All of these are the same names. And that's actually the difference between essential tremors and Parkinson tremors. Parkinson tremors occur at rest and they disappear when you try to move your hand. Essential tremors, they are usually disappear at rest and they get much worse when you try to do something, especially when you try to do something really, really fine or towards the end of movement or when you focus. If you get anxious in doing things. So that's what's called intention tremor.
Okay, thank you. Another question here. Can essential tremor be diagnosed by my general practitioner?
It can be diagnosed by general practitioner, but I think if you come to me with only the diagnosis of general practitioner, I will have to ask my neurologist to see him. I am a neurosurgeon. I'm not a neurologist by training, and I would like, for the safety of my patients, to obtain a neurologist diagnosis. So this is for your own safety. I will not be able to provide this treatment for someone unless there is a neurologist that confirmed the diagnosis and approved the therapy. And that could be our own neurologist, by the way, but I will see you, and I do evaluate patients that refer themselves. I usually do a phone or virtual evaluation first and confirm that all the signs suggest that it looks like a duck, walks like a duck, this is an essential tremor. Then I will refer you to my own neurologist to kind of verify and vet and do the necessary evaluation.
Thank you. Another question here is, how many of these treatments have you personally done at OHSU?
0. We are going to do our first one at the end of the month. But I have touched on this. This is a cognitive surgery. while I haven't done focused ultrasound, I have done all the cognitive work that's necessary to perform a focused ultrasound. There's no hand, there's nothing that I could do with my hand for this surgery. I push a button. I actually click to start this surgery. So the entire work is cognitive by identifying the part of the brain, which is the nucleus and the thalamus, which I do every year at least 100 times, but for a different method.
Okay. And there's some more comments about people like to have a copy of presentation, so we can work on getting that as well. Another question here is I've developed essential tremors from long-term use of my epilepsy. And this is according to their neurologist. Is this treatment applicable for this type of essential tremors?
I think we have to evaluate you. It's possible
Okay.
that you are, yeah. So the answer is not no. The answer, it depends. We have to see you.
Okay. Another question, if I was declined for DBS due to memory loss, is this an option for me?
Yes, it is an option for you.
Okay. And let's see, where would a person get evaluated for head tremors by deep brain stimulation, and what does it entail? That's a long question. Okay.
So great, but actually a great question. So at OHSU, we have a strong movement disorder program. The movement disorder program is, and focused ultrasound could be envisioned as a portion of this movement disorder program. The movement disorder program, or also has another name called Parkinson Center of Oregon, or because they treat Parkinson but other things. It's a fantastic group of neurologists and physical therapists and occupational therapists and 2 surgeons, me and 1 other surgeon. And under this program, we provide medical treatments, we provide surgical treatments in the form of deep brain stimulation or thalamotomy or focused ultrasound. So if you contact the OHSU Movement Disorder Program, and they will be able to evaluate you for your head tremor. And if you're indicated for deep brain stimulation, then that will become the treatment, which is a surgical implantation. So, I mean, it will be difficult to go throughout the entire details of deep brain stimulation, especially when the talk is about something else. But it's a surgical procedure that you will need to be in the hospital for at least 1 night to have the first part, and then come back a week later to have the battery implanted. It's a very well-tolerated procedure. It's still considered minimally invasive, but it's definitely much more invasive than focused ultrasound.
Thank you. Another question is, are there currently any patients on the schedule at OHSU to have this
Yes.
procedure done?
Yes. So we have evaluated 59 patients. We have declined, said that, this is not good for you for one reason or the other, most of which is that you're too early, to about 15 or 16. And we have another 15 or 16 that we sent to our neurologist for confirmation of the diagnosis, perform further evaluation, offer them things such as deep brain stimulation, discuss other options, and the rest is in the pipeline.
You have some more comments thanking you, Dr. Raslan, for taking time to educate us all more on this condition. Someone says this gives them hope, which is nice to hear. And it looks like this might be our last question. Is focused ultrasound or DBS a more popular choice for treating essential tremors among patients?
I think the popularity is changing over time. I think focused ultrasound is getting more and more popular because of its one and done nature, because it's the nature of it's a day procedure. You go home and you don't have to be committed to a device, and there's less risk. That being said, deep brain stimulation is a wonderful treatment, and if that's what you need, and if you are someone who uses both hands, your bimanual treatment, you want to play the piano both hands, for example, and deep brain stimulation is your treatment. But I think the popularity balance, if you will, is focused ultrasound is gaining traction in that domain for sure.
Thank you. And it sounds. Oh,
Go ahead.
Dr.
No,
Raslan, I was going to say, there's still some more questions coming in.
yeah.
Do you have time to take a couple more?
Absolutely. I was going to say I enjoyed this very much. I should do this more.
Okay. Another, it sounds like with the diagnosis of essential tremors being the first step, is there anything else that they need to do?
I think if you need to have the diagnosis, make sure that you tried medical therapy and it didn't work for you, And if you are in the what I call the stage 2 or 3, meaning in the embarrassment or dysfunctional phase, so if the criteria basically is that you have the diagnosis, you tried medication, didn't work, it's severe enough that you want to put yourself into this.
Okay. Another question here is, are there any issues with propanol? Did I get that right? Taken long term?
No, the propranolol is a drug. The only is, it's a blood pressure medication. The only long-term side effect of propranolol is hypotension, meaning if your blood pressure is not high, it could lower it. But overall, it's one of the safe drugs. It's good
Okay.
for anxiety, and it has a lot of effects. It's supposed to work on the peripheral receptors, but it goes into the brain, and that's how it treats essential tremors. It's one of the oldest medications we have in medicine.
Great. Another question is, will I have to stop my medications before focused ultrasound? And if so, for how long?
Depending on the medications. So we're going to have to go over the list of medications. If you're taking things to reduce the tremor significantly, we have to stop them longer than the duration of the half-life. So if the medication works for 12 hours, we ask you to stop it for a day. Some benzodiazepines stay in your blood for 3 days, so we'll ask you to stop for 4 or 5 days. If you're taking a blood thinner, depending on the half-life of the blood thinner, we'll ask you to stop that blood thinner for as many days prior, but we could replace it with a short-acting one. So the answer is that it depends on the medication. So I have to go through the list and go over one by one and decide which one to stop and how long to stop it, because medications are different.
Okay, and then I'm going to jump ahead because that's in line with another question that says specifically, I am a Coumadin patient and my doctor didn't recommend medication due to affecting my INR. Would I qualify for this without
Absolutely.
ever being on meds?
So
Okay.
focused ultrasound would be the treatment for you if you have Coumadin. That's actually one of the most common. What we do is that we stop the Coumadin a week prior when we put you on Lovenox therapeutic dose, which we stop 24 hours before the procedure. The only reason we do this is because we apply this frame to the head, and applying the frame requires putting screw through the skin, so we don't want you to develop a hematoma in the scalp, but there's no risk to the brain. And then 3 days later, we'll start you again on Coumadin. So the amount of time that you will not be receiving any anticoagulation will be only 3 or 4 days. And just as you understand that in the highest category of stroke risk, if you have a heart condition, which is why you use Coumadin, the highest category, the risk is 20% stroke per year, which if you divide that by the number of days of the year, 365 days, the risk per day becomes very, very small. Can't make the risk zero, but if your essential tremors are disabling and you're using Coumadin, focused ultrasound is definitely the way to go.
Okay. Dr. Raslan, I want to be respectful of your time. We have 3 more questions. Do you have a couple more minutes? Or okay, I'm gonna stop taking questions here. But it says, if a patient has anxiety about being awake during this procedure, is it okay for them to take a medication to help with the nervousness?
The problem is the medications that help with the nervousness suppress tremors. If there is a medication that can suppress nervousness and does not impact tremors, which I'm not aware of what that is, then fine. I guess for this particular patient, we need to have a face-to-face discussion first and see how can we alleviate the anxiety. But unfortunately, we aren't able to do this under general anesthesia or asleep yet because we rely heavily on real-time feedback to adjust the location and dose of focused ultrasound, and that's for your own safety.
Thank you. And the last few questions here, what is a current popular medicine that helps with treating the symptoms?
Propranolol is number 1, primidone is number 2.
Thank you. And does OHSU provide the Calia, I think I'm saying this, trio wrist option?
It's an OTC. It's something that you buy yourself like from Amazon. It's not really a medical grade device that way. But yes, the neurologist could talk to you about this and could provide you a prescription, if you will, so the insurance would pay for it. But yes, OHSU is familiar with the therapy and is able to kind of prescribe that. Wouldn't be me, but it will be the neurologists.
Okay. I think we've covered everything. I'm just circling through, making sure I didn't miss any other questions in here. We're all done, Dr. Raslan.
Well, fantastic. Thank you, everyone who attended this or made the time to listen. I truly enjoyed it, and we should have more events like this in the future. Maybe sometime in person. Now we're back to this, being able to meet. So hopefully we'll have one in-person event like that.
That would be wonderful. And I know lots of people are asking about getting a hold of your presentation. So we'll work offline with kind of our team to see what we can do to get that off to you, Gal. Thank you.
Thank you.